Tonight, an alarming rise in COVID cases as vaccination rates plunge across the country, down nearly 85% since mid-April, prompting this stark warning from the director of the CDC.
This is becoming a pandemic of the unvaccinated. Our biggest concern is that we are going to continue to see preventable cases, hospitalizations,
Pfizer
and
CEO told
sadly
us today they're
deaths.
expecting clinical trial results by the end of the year for kids down to age 2 and in the first few months of next year for those as young as 6 months. And while nationally, parents appear divided over vaccinating their 5 to 11-year-olds, some are raring to go. And we've heard of at least one system, Hartford Healthcare, planning to give the first vaccines tonight as soon as the CDC director officially signs off.
We can and we will turn the tide on COVID-19. It'll take a lot of hard work. It's going to take some time. Many of us are frustrated with the nearly 80 million Americans who are still not vaccinated, even though the vaccine is safe, effective, and free. You might be confused about what is true and what is false about COVID-19. So before I outline the new steps to fight COVID-19 that I'm going to be announcing tonight, let me give you some clear information about where we stand.
In different populations that have started to show waning of vaccine effectiveness against infection, not necessarily against severe disease yet, but against infection. And so in our process to stay ahead of this virus, we're starting to see it in infection. We're concerned we will see it in severe disease, and we're planning
Again, it goes back to the more
ahead.
mutations a variant has, the more immune protection that you need from it. So we're really encouraging everybody who's eligible. 16, 17-year-olds just became eligible last week. My 17-year-old got his booster over the weekend, and we're really trying to encourage people to get that boost to bolster their protection so that they're ready should they encounter
the
the
rate
Omicron
of new
variant.
vaccinations has now fallen nearly 85% since mid-April, to the lowest level since January. And as the vaccination rate plummets, the number of new COVID cases is now spiking, up nearly 70% from just last week.
Results are consistent with what Kaiser Family Foundation is finding, and that is the overwhelming majority of inpatients, of people who are getting sick with COVID, and certainly people who are dying of COVID, are those who have been
And here is President Biden. Let's listen in.
The progress we've made and the work we have left to do. And it starts with understanding this. Even as the Delta variant 19 COVID-19 has been hitting this country hard, we have the tools to combat the virus. If we can come together as a country and use those tools. If we raise our vaccination rate, protect ourselves and others with masking, expanded testing, and identify people who are infected, we can and we will turn the tide on COVID-19.
We have about a third of people in this country who are vaccinated. We have about a third of counties in this country that still have over 100 cases per 100,000. We are working to review our
The committee
guidance,
members spent a
update
large
our
portion of the afternoon discussing how much each believe that kids should have access to the COVID-19 vaccine, setting benefits, protecting the kids themselves, but also their families and communities, and helping things get back to normal.
The vaccine-associated myocarditis, these children tends to be very mild, short hospitalization, and a fast recovery. And so when you're looking at the risks and benefits, we also know that for children 5 to 11, we've
And
reduced
so really
the
we want
dose.
to bolster our immune protection to fight against this variant that has a lot of mutations. And so yes, we would really like people to get doubly vaccinated and then get their booster
Places
when
with
they're eligible
low
for
rates
their
of
booster.
vaccination are actually seeing more disease, and we're really trying to go there now to say, please, we don't want to
Please,
hit that
Americans,
worst case scenario.
What more is there to wait for? What more do you need to see? We've made vaccinations free, safe, and convenient. The vaccine has FDA approval. Over 200 million Americans have gotten at least one shot. We've been patient, but our patience is wearing thin, and your refusal has cost all of us.
I have limited time. Let me just ask you something else. What percent of CDC employees are vaccinated?
We're actively encouraging vaccination in all of our employees and doing a lot of education and outreach in order to get our agency fully vaccinated.
But the percent?
I don't have that
for you today.
I'm told that 75 to some north of 75% of CDC employees at headquarters are still working remotely. Is that correct?
We are following regulations through HHS and the federal government.
No, that's not my question. I apologize to be rude, but I'm asking a very straightforward question. I've been told that north of 75% of employees at CDC headquarters are working remotely. Is that correct?
Senator, I don't actually know the number off the top of my head.
Okay, when you
so
look
I'd
down
have
the hallway, are there empty desks? Are over 50% of the desks empty?
Senator, I don't have the numbers off the top of my head. What I will tell you is that we're working closely within HHS and the administration to follow the governmental rules for return to
There was a recent GAO report that shows, and released in the last 2 weeks, that there's been no coordinated response from the federal government to get people back into work. Now, if there's any agency that, since teachers in Fulton County are back at work, that the caseload of COVID in Fulton County is about 88. At its peak, it was 606. If what I've been told by someone who, frankly, kind of knows, that people in laboratories are not showing up. I have no clue how laboratory workers who presumably are vaccinated wearing PPE would consider themselves eligible to stay at home. I say this because I just want to echo. We got to lead by example in the federal government. If our public health agencies don't have enough confidence in the immunization and in the PPE to go back to work, fighting infectious diseases, there's going to be a lot of undermining of a willingness to further fund public health.
We absolutely have our essential labs back at work conducting their essential research towards this response. And we are following the regulations and providing technical assistance and technical support to the federal government for return to work
Dr. Walensky,
policies.
I didn't have this on my list today, but the questions have precipitated it. Do you really not know the answer to the number of vaccinated individuals at CDC, or did you just not want to answer Senator Cassidy's question?
We're still actively working on collecting those data, and those data are updated in real time.
Could you provide that for the committee by Monday of next week?
We are working towards updating those data, and I would have to speak with my staff about where we are and whether those numbers are going to be available on Monday.